Let me go over what cataract surgery is just briefly. When you have cataract surgery, you'll come to the surgery center. This is Prestige Laser and Cataract Institute. We'll get you checked in, take your vital signs, make sure that you're doing well, and there hasn't been any significant change in your general health. The surgery itself is 35 steps, but you can break it down to about 4 steps. Step 1 is to make tiny little incisions in the cornea, which is the cover of the eye. Step 2 is to make a tiny little incision in the bag that holds your natural lens. Step 3 is to take the cataract out, and step 4 is to insert a lens into the eye. The incisions are usually self-sealing, and that is essentially cataract surgery. In the US, cataract surgery takes about 21 minutes to perform. Here at Prestige Laser and Cataract Institute, usually it takes somewhere between 6 to 15 minutes in general. Many patients will ask, will I see anything? I don't want to see anything. Will I feel pain? We tell patients you will not see anything sharp and you won't feel anything sharp. But does that mean you won't see anything? No. You will see colors, lights, shapes. Sometimes people describe kind of a puppet show, and probably one of the most beautiful light shows you've ever seen. Will you feel anything? You won't feel anything sharp, but you will feel fluid, pressure, motion, touch. Those are all normal sensations. At the very end of the case, the antibiotic does burn just a touch at the end, and also the medicines we put in will cause a little bit of an ache for a few minutes after the surgery. But after that, everything should just get better and better. Here at Mohave Eye Center and Prestige Laser and Cataract Institute, you don't have to have an IV. In fact, you can eat before you come in. Also, some of the unique things, we put the medicine in your eye at the time of surgery. So for most patients, it prevents them from needing to have drops both before and after the surgery. Now, some patients will need drops because of either allergies or they need a little something extra, but about 95% of people won't need to use drops preoperatively, nor will they get an IV. You are usually discharged home the very same day. In fact, 99.9% of the individuals, this is an outpatient procedure. Generally, as far as the recovery, most patients are back to most of their normal activities in about 3 days. About 70% of the healing happens in the first week. 99% of the healing happens by about 30 days. Usually patients are asked, when do I get my new glasses afterwards? Usually that's 30 days after the second eye.